Hi, my name is Maddie. I'm going to be your student nurse today. I already have all of my supplies gathered. Can you please tell me your name and date of birth?
Grace Johnson, 10/19/04.
Perfect, thank you. And if the patient was wearing a wristband, I would also verify with that, but they are not. I have provided for privacy, and I'm going to do a general safety survey. The bed is in the lowest and locked position. The patient's collar is within reach, and they would be wearing non-skid footwear. So today I'm going to be doing your wound changing. It should take about 10 minutes. And if there is any pain or gets too uncomfortable, please let me know. I will be measuring the wound to see if it is healing and check for any infection signs. Do you have any questions about me?
Nope.
Perfect. At this point, I would also check the information that was given from the provider to make sure that that is the same. And I would also, as I have just did, I would teach the patient about what I'm going to be doing today. And I'm going to prepare the tape for the dressing before I put my gloves on. And while I'm doing this, I'm going to ask the patient what kind of pain they're in today. What kind of pain are you having? And on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever had.
I would give it a 4.
Okay, perfect. So when I change your dressing, it may be a little uncomfortable. So if you need to take a break, please let me know at any point. Perfect. And as I'm preparing this tape, are you currently comfortable in the position you are in?
Yes.
Okay, perfect. And from this angle, I can easily access the wound. Okay. Now that that is prepared, I'm going to wash my hands and put on non-sterile gloves. And then what I'm going to do next is remove the current dressing. I'm going to do that by loosening the edges with the push-pull method. And I'm going to try and keep the patient as unexposed as possible. There may be some times where I have to uncover the lower portion of your abdomen, but I will try to keep that as minimal as possible. Okay, so I'm going to be pulling at the edges a little bit. I'm going to be gentle. Please let me know if it hurts at all with the push-pull method, and being very careful to not irritate the skin around the wound. Okay, and then I will discard of this. And then I'm going to take out the soiled gauze. And then I am going to be taking Q-tips to measure the depth of the wound. So I'm going to be sticking this in the deepest part of your wound. Please let me know if this is uncomfortable at all. It should be pretty quick. Okay, and then I'm going to measure with the provided. It is about 3 centimeters deep. And I will document all of this when I'm done. And now I'm going to measure the length and the width of the wound. And the wound is about 5.5 inches long, and across at the most wide part, it is about 1 inch. So now that I have assessed the wound and documented that it is, well, not documented yet, it is a beefy red color. The area around the wound seems to have a pinkish tint to it, but it does not seem to have any infection and there is no pus. I'm going to remove my dirty gloves now that I have removed all the dressings. And then I am going to wash my hands. And now that my hands are clean, I'm going to prepare the saline soaked gauze to clean the wound. So I'm going to soak this gauze in saline. Okay. And now that my saline is on my gauze, I'm going to put on clean gloves so I can start to clean the wound. So for this portion, I'm going to be folding the gauze, the four corners in, and using the middle part of the gauze to clean the area. And I will need 5 different gauzes, 1 swipe for each, and I will start in the middle of the wound and do both sides down the middle, both sides on the inside and around the area. So I'm going to take 1 piece of gauze out of the saline soaked gauze, and I'm going to squeeze it out so it is not soaking. And I am going to fold, like I said, the 4 corners in. And use the center of this to clean the inside of the wound, starting from top to bottom, and then discard of that piece, and then grab a new, and again squeeze it out, fold the edges, and then I'm going to clean one side from top to bottom, discard of that piece, and our patient does not have any medications that are necessary, but if they did, I would do the 3 checks and 11 patient rates. And then the other side of the wound. Now I'm going to clean around the area of the wound. Squeeze this out. Go on the outside of the wound, still from top to bottom, and still using only 1 piece of gauze, keeping the patient covered. Do my last wipe of cleaning. And now that I am done cleaning the wound, I'm going to dispose of my gloves, my dirty gloves, and I am going to wash my hands so they're sterile again. I get different gloves again. And put on a non-sterile pair of gloves. And I am going to pack the wound now with sterile dry gauze. And I'm going to use 2 pieces of gauze because the wound is quite large. There does not seem to be any kind of drainage coming from the wound. That is another instance when you would use extra gauze. I am going to fold the gauze kind of like that and pack the wound nice and deep in there and ensure that my patient is still comfortable and there's not too much pain. And do the same up here. And now that my patient has the gauze packed, I am going to lay this abdominal pad on top of it to create a cover. So I'm going to unfold it and put this side facing down, the blue side facing up. I'm going to move this down a little further and place this right on top like that. And now I'm going to use my pre-prepared tape and tape the edges down to create a window pane. Okay. And now that my top layer is placed, I am going to discard of all my products because even if I did not use all of them, they are still now considered non-sterile. I'm going to remove my gloves and wash my hands again. And then I'm going to take a Sharpie and place my initials, the date and the time on the dressing so people know when it was changed. My initials are MJ. The date is the 10th. 26. And the time is 12:30. Okay. And then I would ask the patient, how are you feeling now that I have changed your wound? Is there any pain that you are having? Any discomfort?
Nope.
Perfect. Now thank you for your cooperation today. I hope you're feeling better soon and I will come check on you later. I would leave and then I would go and document all my findings, the measurement of the wound, and then I'm done.